Flexion-based low back pain, a unique approach to treatment. Have you ever noticed that your low back pain feels better when you bend forward or sit down? Do certain positions or movements seem to make your pain worse or provide relief? If so, you may be dealing with a specific type of low back pain that responds best to a tailored treatment approach. This treatment approach is called the McKenzie method of diagnosis and therapy that's used to classify low back pain based on your individual symptoms and movement patterns. By determining your low back pain's directional preference, we can create a personalized plan to help you find relief and get back to doing the things that you love. What is flexion biased low back pain? One type of low back pain that we see in our clinic is called flexion biased pain. This means that your symptoms tend to improve when you bend forward or you go into flexion, and worsen when you bend backwards and go into extension. Flexion biased pain is less common than extension biased pain, affecting only about 10% of people with low back pain issues. But for those who have it, understanding this pattern can be a game changer to finding lasting relief. What causes flexion-biased low back pain? Like many types of low back pain, flexion-biased pain is often related to a problem with one of the discs in your spine. These discs are the cushions that sit between each of your vertebrae. They have a tough outer layer called the annulus and a soft inner layer called the nucleus. Sometimes, due to injury, overuse, age-related changes, the outer layer of the disc can develop small tears or fissures. This allows the inner material to start bulging or protruding out, putting pressure on nearby nerves and causing pain. In people with flexion-biased pain, the disc problem is usually located towards the back of the spine. When you bend forward, it takes pressure off the disc and nerves, providing relief. But when you bend backwards, it can pinch the disc and nerves even more, making your pain worse. Other factors that can contribute to flexion-biased pain include tight hip flexor and hamstring muscles, weak abdominal and gluteal muscles, poor posture or alignment, stress and tension held in the low back. The key to effectively treating flexion-biased pain is identifying these underlying factors and addressing them head on. How is flexion-biased low back pain diagnosed? When you come to a clinic with low back pain, we start by asking you detailed questions about your symptoms, activities, and past medical history. Be sure to mention if you've noticed any positions or movements that make your pain better or worse. Next, I'll do a thorough physical exam to check your spine, flexibility, muscle strength, ask you to do some simple movements like bending forward and backward to see how your symptoms respond. In flexion-biased pain, we often see a pattern called centralization. This means if you repeatedly bend forward, your pain starts to move from your leg or buttock back towards the center of your low back. This is a good sign that the disc is moving back into place and taking pressure off the nerves. On the other hand, if your pain starts to spread or intensify down your leg when you bend backwards, that tells us that extension is likely aggravating your condition. What types of treatments can help flexion-biased low back pain? Once we've determined that you have flexion-biased low back pain, we can create a treatment plan that fits your specific needs and goals. This typically includes a combination of in-office therapies and exercises that you can do at home. Treatment for flexion-biased pain often starts with gentle, controlled bending and stretching movements to help centralize your symptoms. We may guide you through a series of positions, such as lying on your back and hugging your knees to your chest, sitting in a chair and bending forward with your hands on your knees, standing and bending forward with your hands on a countertop or chair. As your pain improves and centralizes, we can progress you to more challenging exercises to help restore normal spinal movement and stability. Other treatments that may help flexion bias pain include chiropractic adjustments to improve the spinal mobility, soft tissue therapies like massage and myofascial release to release tense muscles, stretches for hip flexors, hamstrings, and other tight areas, core and glute strengthening exercises to improve spinal support, postural education and ergonomic modifications, stress management and relaxation techniques. The key is to find the right combination of therapies that works best for your individual needs and goals. I will work closely with you to monitor your progress and adjust your plan as needed. Can flexion-biased low back pain be cured? While there is no cure for flexion-biased low back pain, the good news is that most people can find significant relief and improve function with the right treatment approach. In fact, a growing body of research suggests that therapies based on directional preference, like McKenzie method, can be highly effective for reducing pain and disability in people with low back pain. One study found that people who did exercises matching their directional preference had significantly less pain and medication use compared to those who did general exercises or used lumbar supports. Other research has shown that the McKenzie approach can lead to faster improvements in pain and function compared to other common treatments for low back pain. Of course, everyone's journey is different, and there is no one-size-fits-all solution. But by working closely with a skilled provider, you can develop a personalized plan to manage your flexion-biased pain and get back to the activities you love. The bottom line, if your low back pain feels better with bending forward and worse with bending backwards, you may be dealing with flexion-biased pain. This unique pattern responds best to targeted treatment approach that focuses on your individual symptoms and movement patterns. Our team can help use the McKenzie method to diagnose and treat flexion-biased pain and other types of low back conditions. If you're tired of living with low back pain and it's holding you back, we invite you to work with us. Our approach is compassionate and we'll work with you every step of the way to achieve your goals and live pain-free.